In some remote Aboriginal communities across the Northern Territory, fewer than 10% of people are fully vaccinated. Now experts want the NT to immediately ramp up its remote vaccination campaign before the wet season hits.
It should be happening now because, obviously there are various variants of COVID around. We're all aware of what's happening in Sydney and Melbourne with the Delta variant and the potential for spread.
Dr Parker says given the rate of complex health conditions for people living in remote communities and the NT's already stressed health system, the benchmark needs to be for everyone in remote Aboriginal communities to be fully vaccinated before borders can reopen.
We should be aiming towards around 100% for all adults in Indigenous communities.
A target not everyone is convinced is achievable or advisable.
I think 100% becomes unrealistic, and I think people may then be a bit less motivated to try and go out and achieve those realistic targets if we set one that really isn't attainable.
But the Australian Indigenous Doctors Association wants between 90 and 95% of Aboriginal and Torres Strait Islander people to be vaccinated before Australia can live with COVID. A target they say can be achieved by addressing misinformation, working with elders and sending teams out to remote Aboriginal communities to help people understand and trust mass vaccination campaigns. One thing everyone can agree on is that now is the time to boost the NT's vaccination campaign.
I think we need to take the opportunity we have now, while we do have low case numbers in many parts of the country, to get people vaccinated while we can.
The NT government says roughly 1 in 3 people living in a remote Aboriginal community is now fully vaccinated. Still a long way to go to reach those targets. Lauren Roberts, ABC News, Darwin.